so I learned French in high school. Not really learned because
It's like me in Spanish.
I barely passed high school. I went to this bar. I was 18, and this girl walks up. We start dancing, and I'm like, je t'aime, ma chérie.
Oh, no.
It's like, I love you.
Oh, it does? Okay.
My sweetheart or something.
I'm like, I don't even know what it means.
And she's like, oh, you speak French too? And she's like,
oh, they always do that.
And that was the only thing I knew in French was like.
So you failed.
I failed.
Got it.
That's my French story.
I had a similar situation in Honduras. I did not know the dialect. So all of a sudden, I'm like, wow. They're like, I would say, hola. They'd understand because I had a good accent. And they'd go, blah, 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 and you're like, I was mute for about 4 months. Then you figure out what it's like as a child to learn how to speak. You just start throwing words out, and they're like, swear words. And people are like, what?
Well, welcome to episode 2 of the Ursamin Unlimited Access podcast. My name is Levi, and I'm your host.
I'm Shannon Ellsworth, founder and CEO of Ursamin.
Okay, so what we're really trying to do is build a community of like-minded people, right?
Yeah.
Of course, we believe at Ursamin that everyone could benefit from our software and our app.
Yeah. Everybody thinks that about their product, don't they?
Everybody
needs fresh wheels.
Please, everybody, go out there and download the beta and get started.
All of you at the same time.
All of you at the same
342 million people.
Kids, too.
I'm just thinking that, babies. All of you.
All of you. All right, so, but your experience as a caregiver has, your heart and your passion for the people that have to care for children with special needs or disabilities or
aging parents.
Is one that you and I have talked about a bunch.
Sisters,
friends.
Yeah.
That's what we want to talk about. And not only did you start a company to help solve this problem, and we'll talk a little bit about that, but you have a lot of knowledge and expertise, and you've actually found a bunch of different resources and websites and tools and tips and tricks. So let's dive into that today. So I got some questions here. Let's kind of get started. How does Ursamin help caregivers specifically, like in terms of managing and understanding medical records and information?
There's a lot of information out there. What I found personally when I was dealing with it, actually, I shouldn't say was, I still am. I deal with it with my dad right now. There's tons of resources. They're just all over the place. The healthcare system is intentionally local. It's locally implemented. And so there's all these different tools that you don't know exist, and they try to do some of them online. Some of them are in paper because everybody has different things that they need in the way they find information. So what are we doing sorting through it? Personal experience. We have, like I said, everybody, I think I've said in another, video we did, is everybody on our team is a caregiver in some form or another, and they all need different resources. Nobody's experience is the same, other than you need help because you're spending 20 hours a week doing different tasks that you need. So what we do at Ursamin is sort through all the resources and try and bucketize them and look at validity and look at what are the kind of, you might need financial resources, you might need other people to help you, you might need to understand that person's disease process. Just like every patient is different, every caregiver situation is different because you don't know what's going to happen with your loved one or your friend. And so the goal is just that we collect all those resources and put them in one place, make them easily sortable, and make it really simple for you to find them so that you're not spending a ton of time just trying to find resources.
So if I, going back to the caring for an elderly parent scenario, right? My parents are fine, but, at some point in time, maybe I have to care for them. And if me and my sister are both caring for my parents, I can go into the app.
Yeah.
And if there's a recommendation for dealing with an elderly parent that has a heart condition or whatever, there'll be resources that are in there, links to articles, or maybe the article themselves, or a checklist or whatever it might be, like a checklist, like for when you go to the doctor, these are the 10 questions you should ask. What about like if I go out and find something, this may not be built into the app, so I'm gonna software guys do this next. my sister finds a website,
Mm-hmm.
and she's like, "This is really good, but it's not in our app."
Yeah.
Does she
Submit it.
Submit it.
Submit it. Yeah. There's a place for notes. We're gonna have we have a whole section where it's like customer recommendations, the ideas. We build a community of people who are helping each other. And let's be clear, even though you don't have a health problem today, it's not about that. It's about preparing for that health problem. Listen, we all get old. We all have situations. We all have a situation where all of a sudden we don't have any strength in our legs. How do you then take care of a parent who cannot walk, but you want them to age in place? What are the things that you have to do? How do you get financial resources to help you pay for the upgrades on the house to manage your parent to live in their home? That's what everybody wants because there's no room in the nursing homes. There's not enough staff. So all of a sudden you end up with a parent who has needs, whether they're direly, is that the word?
Dire.
They're in dire situations or unless they have a heart condition. The records are a baseline. We say the records because the records, elderly people have the most history that when they do get sick, you need to see that history because you need to understand kind of where you're going with. It's like a car. They don't just look at one part of your car. Usually they look at the body and everything else to diagnose. But it's really about helping their quality of life in the long run. So if you have a site that you like and that site is, hey, this is great, post it. And we'll have a forum that says, hey, people whose parents are not sick. I just found this really cool site to work on a DNR or a living will, or here's a really cool tool. And nobody has that right now. That's what I thought was interesting for me is that there's not a site where we can hop on and share sites, and they have it for the patients. They have all sorts of cancer patient support groups. How about a caregiver support group that's online that you can say, hey, I found this resource. It may or may not be useful, but at least it's easily sortable once you put it up. Somebody can go, oh, I need that.
Again, you're right because I haven't had that experience yet, and there's this
kind
guy,
and
I'm a guy,
and you're a guy. Sorry, guys.
So
a lot other guys take more accountability.
That's right. But no, I think it's also the idea of preparing for this.
Preparing, yeah.
Death. Medical is inevitable to some extent, right? Just having it all in this one place is really good.
Yeah.
Well,
planning. I think planning, more importantly, maybe that's what we need to say, is planning for the inevitable that we never thought. I call it the job that you didn't, we were going to name the group, the job you haven't been trained for. It's 53 million caregivers, going to be 90 million in the next 5 years. That means we're all going to be a caregiver at some point. And you also have to juggle that with the rest of your life. So planning for that day is going to make, as long as you're a good planner. If you're not a good planner, well, But go ahead. Sorry.
What other resources, let's talk about some websites outside of Ursamin that you feel are extremely valuable to different caregivers for different reasons. And so I can, I've got a list right here, but so let's just kind of start with USA.gov and how you might have used USA.gov and what do you like about that website?
Yeah. So there's multiple resources. Yeah. There's national resources. There's local resources. I think the national, like USA.gov, AARP, caregiver.org, these guys are all really good at preparing you for what you're going to need. So they have a lot of, hey, here's the checklist. Here's some of the things to think about. Here's the plan you have to have. Like, we talk about a DNR and it kind of gets said, tongue in cheek, but we don't realize how many times you need that just to get help. So the caregiver.org and USA.org, there are national resources that are just great at preparing and helping you understand what happens is in the healthcare system. It's nationally implemented. So here's kind of the structure that we're living with, and then it's regionally implemented. So then you dig into your regional resources. What does that mean?
It seems, well, I know what regional and national might be, but why would it be different for us here in Syracuse versus Nashville?
Because the health situation, it's very interesting. It's a great question, and it probably needs to be clear on the website now, is each situation is different. In Florida, you have a very high senior population. Their chronic illnesses are different than what you see in Syracuse. Syracuse does not have a high diabetes problem. There is diabetes. Diabetes is like a national
epidemic,
right? It's a really big problem. It's a worldwide epidemic. Obesity and just the way we've built our food has created a problem with diabetes, but it's not as big as the number one state for diabetes in the U.S. is North Carolina. Why, people don't know. But so what happens is it's driven by the politics, and they locally say, okay, we're going to address this problem in our state. So New York has a very high caregiver population. So, but what is that? It's 25% of the caregivers are just taking care of their aging parent who doesn't have a dramatic illness, and the resources that they need are different. They just need help navigating where the money is, there's a program called CDPAP, which is consumer-directed healthcare, that you can get paid to be a caregiver for your parent. Those resources need to be available. That's not in existence in California because they have a different issue. So why regionally? Healthcare is implemented regionally because the health situation of that population is different. And so they bring the resources to bear to be more relevant to the people who live in that state.
Well, there's also, I would assume, New York State might provide different social benefits than Florida, right?
Politics,
so there's politics, there's the money and the resources behind it.
Yes.
But also we have a different, hospital. We have 3 hospitals here in Syracuse,
too many.
right? And whereas maybe, a place like Nashville only has 2. I'm making it up. I don't really know. So that's why it would be regional.
Yes. Different hospital system. It's funny you mentioned Nashville. I'm trying to think of how to communicate it. Nashville is very much trying to become a healthcare thought leader in disease prevention and certain things that they're zeroing in on. So in North Carolina, similar, Raleigh is becoming a big gerontology group. So they've kind of picked an illness or picked an area. If you look at healthcare, there's multiple, there's cancer, there's diabetes, there's age groups, and they've picked a specialty to really stand out and try and bring some thought leadership. So again, it may be because their population happens to have that, or you've got a caring community, medical community that really wants to advance that particular field. And so it ends up just coming out differently. And there's incentives to do that, right? It's all kind of politically driven. I don't mean politics and bad, but in that there's initiatives at the state everybody wants to see happen, and they get put in place.
Yeah, you're saying the word political, but I think you're meaning more of government.
Yes.
Right? Yeah, just the government. Yeah.
The government overall. Yeah.
That's the USA.gov, and is it USA.gov?
USA.gov. There's CMS, which is the Center for Medicaid and Medicare Services. That's there's 38% of the population in that. AARP is national. They all have regional offices. Every single one has a regional office.
What about some other ones? So I'm looking at
who else do we put in there?
Let's see here, Caregiver Action Network. That seems like a private entity, right?
That is not necessarily a private entity, so much as, and it might be.
Yeah,
I don't know.
Caregiveraction.org.
I don't know the actual structure of that particular group, but they do a lot of lobbying and things for the caregivers. So it's a caregiver action network. Meaning we want to go take action and stand up for the caregivers and represent the caregivers, because historically caregivers are kind of underrepresented in the population, and now because they're so required because of the healthcare shortage, because of this aging population, everybody talked about Social Security and Medicare being depleted. Nobody talked about who's going to take care of these people as they get older and they need help. And so they're an action network. Their goal is to create action and motivation within the states and within a national level to support caregivers. So they're a great group if you want to add your voice. There's another group, I can't remember what it's called, but
Family Caregiver Alliance.
Yeah, Family Caregiver Alliance and the Caregiver Action Network. And I've started to find those because we want to stand up and have a voice, but we need all the caregivers to join us and have that voice and say, listen, we need these resources. That's what everybody wants to hear. What do you guys want? That's what the investors, that's what the action networks, that's what government wants to hear. There's people who go get in front of Congress, and we'd like to do this at some point as well when we have the time, is go stand in front and say, this is what people have told us they want. Can you mandate this? And or doesn't have to mandate, but you get a national support for an initiative. It's gonna make a difference as it rolls out to the states.
We're here looking at the website, and I see for the Caregiver Action Network, it says 10 tips for caregivers, right on their homepage.
Yeah.
And so there's these things, and I imagine for most of us, when the time comes for us to become a caregiver, we were happily doing nothing.
Yes.
Doing whatever our life was, playing golf, watching Netflix, whatever, to all of a sudden now having almost a full-time job depending on
Yes.
who you're caregiving for. And so these websites are here as a way to
plan.
plan.
Involve your parent in the planning. Listen, my dad, here's one of the things we want to do. We want to do a notification. Hey, tell your dad or your mom to call the doctor, get this information, and put it in the app. It gives them dexterity stuff to do. It gives them practicing on their phone or their tablet. The parents, more often than not, they want their dignity. They want to do it. You just don't know what to tell them to do. This was my biggest struggle is I don't know what to tell my today walking out the door, we were getting into an argument because he couldn't tell me where his bank accounts were on either side. He was like, well, my $2,000. So, and it was like, I said, okay, do this and then we'll sit down and I'll come back and help you. And as a caregiver, that's what we want to do. We want to help our parent and our loved one do their thing, but we don't know what to tell them to do. So the idea would be is those 10 things we plop into the tool. Plop, it's probably a little bit more technical word than that. Plop it into the tool, give you something, and you go, okay, Dad, hey, I need you to make sure that your DNR is filled out. There's a little site here. Go do it. Gives them something to do. I don't want that to sound like they're children, but they have the ownership to do that. And they control, listen, a DNR is their choice. Living will is their choice. All of that stuff is not something you as a caregiver can do. Don't get caught. Don't get caught with them not having that and you having to make decisions that, quite frankly, aren't theirs. Am I scaring you to get involved with your parents?
No. I decided to re-watch The Sopranos. Have you ever seen that?
I have not.
Okay. So.
And I've been looking for a TV show. I'll have to do that.
So The Sopranos. Well, one of the Sopranos' elderly Uncle Junior, right? Whatever. He becomes, he gets cancer, ends up getting dementia.
Yes.
And Tony Soprano, and by the way, he's also like in house arrest. So there's more to it.
So is my dad. Don't get it.
Right.
Shannon in house arrest.
But no, I think
because he's not supposed to.
But you're kind of watching it, and it's just hard.
It's hard.
It's just hard, and part of the show is like Tony Soprano, the main character, keeps having these. He remembers what Junior was like before.
Yeah, it's a big thing.
They were, horrible, murderous gangsters, but still.
Oh, I was thinking more like my dad used to be able to play golf, and
no,
and now he can't move, and and they say it's
not nice, but I think more importantly, it's just like this idea of like, Tony Soprano's not prepared.
You're not prepared, it's interesting. I talked to a gerontologist from North Carolina, and she said she actually she's a founder of Neighbor Force, and they are an app where you can pair a caregiver with a senior in the home for somebody who doesn't have me or you or children to rely on, and they can pay for somebody to come in. They say more often than not, it's a company, but it's a dignified way for them to get help. That's their choice. And she said, what's interesting is people think life is a straight line, but it's actually a circle, and we're all going to go through this. At the time, they're going to hit a certain age where they're 3 years old again, and there's things that they just can't make those decisions. It's too hard. And you have to help them make that decision. But they're also your parent. They don't want to be told what to do. So you have to do it in a dignified way that allows them to make those decisions still. And it doesn't come to a point where all of a sudden you're both careening you're careening out of control and now trying to clean it up. You end up fighting and exhausted. So yeah, that's kind of interesting. I'll have to watch The Sopranos because I hadn't seen that. I see a lot of other shows about parenting. I should call it childing. Should we call it childing?
The Sopranos is not about.
You're like, probably not, but yeah.
There's a lot of other reasons. Okay. Well, thank you so much for talking about that. Let's just kind of jump into what's going on at Ursamin today.
What's going on? Our beta is up. We are running tests right now for getting on. It's all user interface. So what does that mean? Do you like it? Do you not like it? Is it easy? Is it something that you enjoy getting on? The first part is authenticating you are who you are. So we haven't really talked about security that much. Security is crazy important to us. Our responsibility is to make sure A, you are who you are, and B, that we protect your data.
So get your ID card ready.
Get your ID card ready. Everybody forgets this. Get your ID card ready. Make sure that, and we do facial recognition because we think it's going to be the easiest way for people to do it versus you can take a picture of how many of us do this, a water bill or something like that. That's more painful. So we're even considering biometrics. to make it as easy as possible, but also ensure the highest security and then protection of your data. Nobody on our side's ever going to see it. Just to be clear, this is not about us. This is about you. We want to be the value add on top of the data when you get it. So the test is this interesting? Is navigating it interesting? Is it easy? There's a resource page on there, which is exactly what we just talked about. Websites, DNR places, living wills. We want to do is have partnerships with legal firms who can help you do that and make it easy, cheap, because there's a lot of those out there that, like, I didn't do a living will because you go to a lawyer near you, it's $1,700. It's like, who has that money? So there are discounts and all this stuff that's applied for you and your parent, more under your parent. And then you as a caregiver can say to your parent, go engage and get your living will written. Go get your DNR. Don't make your children make that decision for you on your most. You do that. That allows them to have control. So that's where we're at in that testing is really about just, is it easy and do you want to get on? So we'd love to have everybody join it, hop in. We've got resources available to help you get online if it's too hard. We'll pull the records. We'll start pulling records for you. If that's what you want, you just check the box once you're in the tool and away we go.
Yeah, I signed up and it took, I don't know, a minute, 2 minutes. It was really
perfect.
easy.
Perfect.
It was
Once
really
you had
easy.
your license.
Well, that's true. So
Which everybody, we had when we first launched, funny enough, we had 133 people click on it and then nobody went any further because nobody knew they had. So again, part of the test is make sure somebody's ready. Nothing wrong with that. It's just we had to learn, and that's what we're doing is we're learning what is where do people get stuck because they should be able to get in and get out of that app pretty fast, get some value out of it, and move on with their day.
If just thinking about it, if my sister signs up for it today too, let's say beta. So
Yep.
I'm signed up, my sister signed up.
Yeah.
But we want to care for my father.
Yep.
My father is the one that needs to sign up,
Correct.
right?
Yes.
So if he signs up, does he say Jesse and Levi have access to my account?
Yeah. So in this round, we don't have the profile. We don't have the ability to connect you yet because we wanted to get the user interface tested first. Then, but yes, he has to sign up. We have realized that for people who have parents who may not be as tech savvy and be able to do that, that will probably have an easier way for you to get your parent signed up if they're not, because that's where I've been reading about ageism on technology, and they don't understand how to do facial recognition. It's just not in their DNA. So we'll have that. But the next round we're going to have where he would check the box, and he would also have the opportunity to say, I want to share XYZ. So you can share your whole account. You can share your account with Jesse. Jesse can share hers with you, or you can pick and choose what you want to share, because that's the most important.
And Rachel and Becky.
And Rachel and Becky.
If you guys do it too, that's fine. I just picking out Jesse because
no picking favorites. No favorites.
She's closest to mom and dad. That was it.
Yeah.
I know Rachel and Becky, you also love mom and dad really well.
Well, and it's important to know.
I have 3 sisters, as you can tell. So.
Well, and and here's the thing. That's the beautiful thing is everything we want to do like a family plan where you don't get dinged, because everybody plays a role. In my family, I was the technology person. I was with my parents. I was a half a mile away. I could run over, get them logged in, but then everybody else would get access to that depending on, somebody was a nurse, somebody else was doing financial stuff, and so everybody could get access. So, yeah. So
well,
that's a good
really neat point. I think I live up here in Syracuse. My family lives down in Georgia.
Yep.
And, one of my sisters lives in D.C. and the other one lives out in Arizona, right? So the one sister that lives in Georgia caring for potentially day-to-day, face-to-face with my parents, whatever she does in that app, me and my sisters can see it.
Yeah.
That's really neat.
Yeah. And your parents may or may not want them to see it. I'm not gonna lie. Sometimes there was like my mother would yell at me and say, "Don't give them my data."
Yeah, I'm definitely cut out of that loop.
And you know what? Because sometimes remotely you can't do anything. My brother used to say, "I feel bad. I can't do anything about it." And I'd say, "Tim, you're playing your role. Your role is the cheerleader." Listen, you got a bunch of women together trying to navigate this, thing. Very passionate. Sometimes, he was the one who made sure the generators were still working and the stuff that we needed him to do. And there's value in that. And he can check in and say, this is what he actually, he was really valuable because he lived right near the hospital in New York City that we ended up taking her to. And we stayed at his house and he kind of helped us navigate there. So you just never know what role. And like to your point, you can see everything that's going on. You don't have to, or don't share. You only need some. Like maybe somebody plays the financial role and you only need to see the financial information. I'm not saying that's going to happen, but you can pick and choose what role people are going to play, and you don't have to get confused with this flood of information because the person sharing it doesn't know what to share.
Well, that's a really good update. Well, thank you so much, Shannon. We'll wrap up today's episode. For everybody out there in the audience, we here at Ursamin, we believe that you, people, humans, make better health decisions when they have access to all of their information, all of their records, all of their health data. And if you have access to all of that in one app, you're going to be healthier. Thank you so much.
Thank you so much.
Yeah, great. And have a good day.